Awesome. So like I said, if you want to throughout the chat, you're welcome to get up, get more refreshments, that kind of thing. We want it to be welcoming and enjoyable for everyone. So no worries there. I do want to welcome you here to Science North and the first of our series of 2 Community Health Connections Science Cafes. So through these events, we hope to provide you with a place to connect with a variety of experts and peers to learn about, discuss, and ask questions about COVID-19, vaccinations, and other health topics. We want this event to offer a safe and welcoming space for everyone. So we'll also be providing opportunities throughout the day or throughout the evening for the audience to provide and share experiences or your opinions and also ask questions if you'd like to. We will also be recording audio from tonight's session so that we can share it as a podcast. This will allow us to share our information and what we learned today with an even wider audience, even if they couldn't join us today. If you wouldn't like your audio, if you ask a question or share an experience, if you don't want that included in the podcast, no worries. We just have our blue mic box and you just don't speak into the mic. Talk to us directly, and then your audio won't be in the podcast, and that's no problem. Before we really jump into our questions with our panelists, I do want to take a moment and reflect on where we're gathered tonight. So Science North and Dynamic Earth are situated on the traditional and ancestral lands of Atikameksheng and Anishinaabeg and Wanapateh First Nations, and we're in Robinson Huron Treaty Territory. We give thanks to the Indigenous peoples who've cared for this land since time immemorial, and pay respect to their traditions, ways of knowing, and acknowledge their many contributions to innovations in science, technology, engineering, and mathematics, past and present. We also recognize the Métis Nation of Ontario for their historic and ongoing contributions. We commit to deepening engagement, relationships, and partnerships in order to advance truth and reconciliation, honor and reflect Indigenous ways of knowing, grow economic opportunities, and collaborate with Indigenous peoples as partners in order to inspire all people to be engaged with science in the world around them. To get us started today, let's get to know our panelists for the night. So my name is Grace, and I am a staff scientist here at Science North, and I work on our youth and diverse audiences portfolio. I'll be your moderator for the evening, and then we have here our panelists. So we have Carly McGibbon, who is a public health nurse with Public Health Sudbury and Districts. We have Sibin Velatukudil, who is the Cambrian College International Student Services Program Coordinator and a regulated international student immigration advisor. And we have Wenda Olia, the mental health outreach worker with YMCA Immigration Services. So to start us off, can we actually take a moment and have each of you tell us a little bit more about yourself and your work with healthcare or with newcomers?
Good evening. So I'm Carly. I'm a public health nurse, and I have been here in Sudbury for 18 years. Most of the work I do is around vaccines and infection control. I was one of the nurses heavily involved in the COVID-19 vaccine program rollout here in Sudbury, so that's most of what I do on a daily basis. Vaccines for people of all ages.
Hi everyone, my name is Sibin Jacob Velatukudil. I'm a coordinator, International Student Support Services at Cambrian. I came to Canada 10 years ago, then moved to Sudbury after 6 months looking for a job here and there, like in Kitchener, then went to up north, actually to Geraldton, like 1,000 kilometers north from here. Then moved to actually south, to Sudbury. With my wife, wife got a job here, that's how we moved. Then I actually seek YMCA to find an employment. Lucky, I got an employment at YMCA itself. With that one, I worked at YMCA for 5 years with immigrant services, so I was assisting other newcomers to settle in Sudbury. Then 5 years ago, I got an opportunity at Cambrian College, and I moved to Cambrian College to support international students with their on-campus support. I also got my license as regulated international students immigration advisor. So now I am supporting students with their on-campus and immigration support.
Good evening, everyone. My name is Wenda Aulia. I'm the mental health outreach worker at YMCA Immigrant Services. So I came to Canada as an international student 10 years ago. I used to live in New Brunswick, and I worked in settlement agencies there. So throughout my career, I've been working with newcomers, refugees, permanent residents, international students, and refugees. So now at the YMCA, I work with all kinds of newcomers, different immigration statuses, and I support them in terms of their mental health. I help them connect with mental health services and programs that are available and accessible to them in Sudbury, in Ontario, and throughout Canada.
Great. So I have some questions for us to start this discussion tonight, but as we speak, if you have thoughts or questions that kind of come up, you're welcome to kind of give us a wave and we will bring you the mic if you want to speak into that. And then I do also have some questions in my lineup here that we'll reflect back to you. We'll say, if you'd like to answer those questions, we'd love to hear about your experiences as well. So to start off, kind of thinking about the journey as a newcomer to entering our healthcare system or using our healthcare system, one of the first things that, even as not a newcomer myself, that I know is that the healthcare system is filled with documents and forms and so many different places to access care. So do any of you have sort of some tips or ideas around, so what are some of these forms and where can newcomers find resources to help them know what forms and documents they will need and how they can access care using those?
Sure. So you're absolutely right. Accessing healthcare and navigating healthcare can be difficult. Public health is a really good place to start. We can help you sort of get that stuff set up. One of the things also is to access a health card. So I think newcomers have to be in Canada or in Ontario for 3 months to access a health card. So that is done downtown at Service Ontario. So once you get your health card, it's easier to move about. But public health will help you with documentation that you need filled out, and as well as some services. So the bulk of what we offer is free of charge. You don't need a health card. So immunizations, there's dental screening for kids, women's health services downtown. So all of those things we can help you with and give you some good primary care while you're getting sorted out. I think the question was around health card. I think it's 3 months. Once you apply for your health card, you have to be in Ontario for 3 months. Am I correct?
I can answer that. I am new to Sudbury. 4 months for me.
Do you want to, my friend CJ here has the mic and that'll help everybody here if you want to talk into it. There you go.
Yeah, it's a mic. It's nice to hold such a big mic.
Hold it up to your mouth, though.
Okay. So it's been 4 to 5 months for me in Sudbury now. So as soon as I landed, all my colleagues suggested to first go and register for the medical card, the Ontario medical card. And I didn't have this 3 months notice there. I mean, there was no waiting period of 3 months. I immediately got it. I went there, I applied, I showed my work permit, and they took my registration. And immediately in a couple of weeks, I got my health card.
Thanks, Karthik, for mentioning that one, because there were something happened with the COVID. The waiting period was actually waived off for OHIP coverage. So if you are eligible, if you have to have like the 3 documents that need to prove that you are eligible for any new immigrants with permanent residence card, or if you're coming to Canada with a work permit, and if you are employed and if you can provide that proof, that then you are eligible to get your OHIP coverage right away. And that's something good happened with COVID. Yeah.
Yes, COVID definitely shook a lot of things up, and that sounds like something good that came out of it, is being able to get that coverage.
Can I add from international
Absolutely,
students' point of view? Because many of the international students that I serve, they when they come, their tuition fee also included a health insurance plan, so they get that health insurance plan, and that covers most of their healthcare requirements when they are in Canada. So that will cover 30 days prior to their program start. So that's how the health insurance card work. Only thing with that one is sometimes it may not cover the pre-existing condition because it's a private health insurance, it's a third-party insurance that we get support from. But international students also covered through that one. Good thing about if an international student is coming with their family and family, especially spouse, is able to find a job, again, they are able to get covered under the health OHIP coverage through their employment in Sudbury or in Ontario.
I would like to add a little bit too. So I know that the forms can seem sometimes intimidating or especially finding out information. There's so much information on different websites, on Google. So if you come to the YMCA Immigrant Services as a newcomer, we help with, that intimidation part. Like we can help you guide on where to find information and kind of filter it down to make it easier for newcomers to find specific information. And if there is a need to fill out forms, you can also come to YMCA and we'll help out with filling out the forms. Thank you.
That's great. Kind of continuing on sort of that journey or that topic of receiving care. So we've got some documents. We have our health card now. The news has been, there's lots of stories around it, and just, a lot of us maybe have experienced it. Family doctors are in pretty short supply. They're very busy. They may have long wait times. So what's the benefit around having a family doctor, and is there a way that newcomers can find one? Do we have any tips on how they might be able to get that kind of care?
I can speak to that a little bit. Having a family doctor is absolutely beneficial, but you're right, it's not always easy to find. When you do have this primary care doctor, it's kind of like all your stuff is in one place. There's someone who follows you and your family across the continuum of health, so that's really important. When you register for your health card, I believe it was Healthcare Connect, but I think they're rebranding it. But there was a program called Healthcare Connect. You could fill out the forms and they would try to match you with a family doctor who was accepting new patients. In the meantime, if you need medical care, then with a health card, you can access walk-in clinics. Of course, you can go to the hospital if you need to. There's nurse practitioners that you can sometimes see. So all of those people can help you. Sometimes you get lucky at a walk-in clinic and the physician has their own practice and they'll take you on as a patient. That's the best, but you just kind of have to keep trying until you do find that family doctor that'll care for you and your family, and then everything's all done in one place.
Yeah, just to add to that one, it's when you are here, it's hard to get because you once you register in Healthcare Connect, it be in the waiting list. But if you are in healthcare need, especially if you are with your young children or with any health conditions, sometimes you may get priority in that itself. The other thing that you can use is if if your family member or any community member is with another doctor and they can ask the doctor, nothing wrong in asking the doctor if they are accepting another new clients or not, then sometimes even though it's not in the system, they may accept. In that case, they can just track your information from Healthcare Connect and they can accept you as a new patient, so that or client. That'll be something good, and also you can access every service through walk-in clinic, because it's not something different. Only thing is, walk-in clinic, when you go, they may not track your records your previous and things like that. If you have a family doctor, they can do the periodic checks and everything. When you do not have a family doctor, you have to take that initiative and go to the doctor for those kind of checkups.
Great. Now what I'd like to do is actually give us a chance to allow you to share any experiences if you'd like to. So, we've talked a little bit about some of the things we know in terms of where you can get healthcare or find a family doctor. Does anybody have any experiences or questions already that you'd like to ask or share with our panel?
I am so happy to hear that things changed during the pandemic with regards to seeing a doctor. And you make it sound so easy, but after 5 years, I've finally gotten a health card. It is not that simple. I broke my leg in 2019, and the doctor literally sent me home with a bandage on it. He told me that he was worried about not being paid because I didn't have OHIP. It is not that easy. I've only recently gotten a health card. And for my children as well, I tell them all the time, when they go outside, I say, don't be a dum-dum, we're not going to the doctor. I know, it's rough, but I just tell them, And it costs $150 for an immigrant to see the doctor if they're going just to a clinic. So I don't know if it's changed for all immigrants across the board, but in my case, and I know many others as well, they can't get a health card. They're still under the interim federal health plan, and that doesn't guarantee a lot of services. So that's why I'm here for information, because I was one of those people, and I don't know where to go or where to start. I appreciate this, but it's not the same for every immigrant across the board. 3 months? Somebody said after 5 months they got a health card? Oh man, they were smiling on you.
I would like to give a comment on that. Yes, I also just learned about how, unfortunately, it is a barrier in Sudbury, especially being kind of a remote area. Some hospitals or medical professional clinics, they don't have connection with Medavi Blue Cross, I believe is the organization that bills to the federal government. Right, so that's why that's still a barrier, and we still don't have that access. Exactly. Right. So I hope, people who can make those, the changes in this medical field can listen to this podcast later. You've made the change then. Yeah.
Yeah, that's because most of the healthcare are from Ontario, and the one that you mentioned is from the federal government, and that's most of the doctors are not registered with. But it's good that you clearly made one doctor aware of that one, and that doctor may help other other clients too. So please do share that with YMC and other newcomer service agencies so that they can also use the same information for others.
That's really great. If we can take anything from this, it's hopefully we can get more doctors in the North aware of that program so that fewer and fewer people have experiences like that, because that does not sound pleasant whatsoever. So, and doesn't sound fair whatsoever. That's not something you should have had to go through. So, you as well? Yeah, of course. CJ, I'll bring the mic.
Yeah, okay. Thank you so much. I just want to know if you can explain a little more about how can I get a family doctor, because I hear that's like a hunking games. You're going to find a family doctor, no? So I'm going to know how does the procedure, how documents can I have to fill, or where can I go to get on a wait list, actually, right? So that's what I don't know.
So once you have your health card, you can go to Healthcare Connect. That's an online application form that you have to fill. Once you are complete the form, then you will be in the waiting list. Then as soon as the doctors accept new clients, they will get that the people from that list. So it will be first come first serve. So if you already applied online, then you will be in the waiting list. And any doctors, sometimes you will hear that in the news, there will be more family physicians are joining in a Sudbury team and things like that. Then you can always check with those doctors if you're already in the list.
Okay.
And I'll just add, family doctors, they do get money when they go into the Healthcare Connect list and they say, we're going to accept 20 new patients today, and they pick the people off the list. There's an incentive for them to do that. So registering with Healthcare Connect is the best way, and then they'll match up and they might say, today we're accepting new families, or we're looking for families with children, or we're looking for just single people, and then they'll go on the list and they'll be matched with the people, and it's beneficial for them because they do get a bonus.
Thank you. Healthcare Connect.
Great. I think we've touched on this piece a little bit already in terms of the provincial healthcare plans, and we talked about the interim federal health plan. Those cover basic health needs. What about if we go farther in terms of looking at eye care, dental care, and prescriptions? Are there programs or things in place that can help with access to those types of care as well?
Well, I know at Public Health, there is a primary care office for families that have children under the age of 6. And it will act kind of like a family doctor or a walk-in clinic, and they service families with young children. But what we also have at Public Health is any vaccines. Most of them are free of charge. It just depends if you need specialty vaccines for work or for school, there may be a charge for those. But for sure, if you have children that need vaccines to attend school, we absolutely will do those for free. We also have a dental program at Public Health for children under the age of 17, and then I believe it's also for senior citizens. For adults, there's nothing, but we do see children under the age of 18 as well as seniors. And then I'm not sure about the eye screening in Ontario. I think it's covered for children as well under the age of under 12. Yeah, so the eye screening as well as would be free.
Great. So we talked a little bit about how COVID has changed some things. It's changed that waiting period for the health cards. It's also shown us a very different medical and health environment than what we had before the pandemic. And Carly, I know you did a lot of work on immunization and COVID-19. Are there or were there programs and supports in place to help newcomers with knowing what vaccines they need, COVID-19 and otherwise, and how they can get them, where they can find them, and where they can find information about COVID, because that's a whole nother ballpark.
Sure. So there is COVID information on the Public Health website. COVID vaccine program is still running strong. We still have clinics every day, but it's certainly slowed down a lot from what it was last year or 2 years ago at this time when we were, immunizing thousands of people every day. Now it's definitely slowed down. The need has slowed down. But what we did try to do is to I don't know if we had a bus. So I'm not sure if any of you have ever seen our vaccine bus, but we tried to take the bus to areas where people who maybe didn't drive or they didn't know where to go. So we did take the bus to all 3 of the post-secondary institutions. We went to Laurentian, to Cambrian, and to Collège Boreal. So we took the bus there. We would also take the bus to areas, or we would set up in community centers, maybe in housing areas, in areas where people, like we said, they didn't drive or there wasn't good bus access. So we did try to bring the vaccine clinics to where the people were. And when we're there, we're absolutely willing to help with other vaccines, set you up to come to the health unit. And that's where we provide the rest of the stuff. and help with documentation. So one of the things that we saw was a lot of newcomers to Canada had COVID vaccine done in other countries. So we need to take that documentation and register it in Ontario, and then we can then print you proof of Ontario vaccine if that's something that you need for work or school. So that was definitely a big undertaking and not something we see so much right now, but definitely, when vaccine was brand new and it was required to do anything, we did do a lot of work with translating the records and transferring it over onto an Ontario card.
If we sort of continue down the vaccine road, I know also you've mentioned as well vaccines for children and vaccines needed for school. So what kind of vaccines are needed, or is there documentation needed, or what things should newcomers know about children?
Sure. So right now what we're doing is actually, so for children under the age of 18 that attend either elementary school or high school, we're reviewing all those records. And that's something that we used to do every year, but we now haven't done it in 3 years because of COVID. So we're looking at it school by school, all the students who are enrolled, and we're saying, okay, what vaccines do you need to be considered up to date for Ontario? So sometimes families that are new to Canada may have received their vaccines elsewhere and they're not recognized in Canada, or some of the ones we do here are missing. You might have extra ones. So what we do at Public Health is we send letters to these families, and then we invite you to contact us and provide us with the vaccines that you do have, and then we match them up against what's needed here in Ontario, and then we'll work with you, and you can come in to get your child up to date, and all those vaccines for kids are always free. So none of the vaccines for your kids to attend school would cost any money, whether you have an OHIP card or not.
So with us, when families comes to, as an international student, when they come with their families, and especially when they have young children, we usually in every intake we have a pre-departure session that we conduct to most of the students who are coming to that semester. So when we provide that pre-departure session, we also cover the dependents documents, and that includes the immunization record for the children, so that they can have those records from their home country itself, and they can go to public health to get their immunization record from here, so that their school joining over here will be
Yeah, they often, just different countries provide different vaccines as a routine. So then when you come to Canada, we just need to get your child up to date for what they need to attend school here. Some kids, it's very minimal. Some kids may require more vaccines, just depending on what they had and at what age.
Yeah, we are just trying to get those documents well in advance, so that they will bring that one with them, so that it will be easy for them to get admission to the schools over here.
We talked about them a little bit already, but I want to go down a little bit farther into the topic of barriers and what kinds of barriers newcomers might face in terms of accessing healthcare. So we heard from the audience already that physicians are sometimes hesitant to provide that care because they're not under the plan. But what other kinds of barriers? And this one is another question open to our panelists as well as the audience. If you have additional barriers that you'd like to tell us about that you've experienced, in terms of what kind of barriers do you experience in terms of getting healthcare?
I can just talk about one thing that we saw a lot at Public Health, and with COVID vaccine at the beginning, everyone needed an appointment. So for some people that were new to Canada, if they didn't know the locations where we were in, or they were having difficulty with the eligibility criteria, it was hard for them to make an appointment, keep an appointment. We know some people had transportation issues. They may have had childcare issues. So for some people, they would present at our clinics without an appointment, and we would say, sorry, we can't see you. But what we've learned and what we now understand is that just to come to the clinic, you may have had to jump through many hoops. So we are certainly trying to be more accommodating to families that just getting to the clinic, is already a lot of work, and trying to understand that not everybody has the same access to healthcare.
One challenge that we had before was the waiting period, because there was a 90 days waiting period for anyone who's with a permanent residency status, or if you are a temporary worker and if you have to like work for 6 months to get your OHIP coverage. Now that is moved due to COVID, and that's good. But other challenges at this moment is if they are changing their status or applying for an extension, and sometimes IRCC take little longer time to process the document, and at the time, even though they are eligible to stay back in the country or to do things as per their current permit or the previous permit allows them to do, but when they want to extend these kind of documents, they need a valid document, and sometimes, especially students who apply for their post-graduation work permit, their study period, they got the coverage from the health insurance that they paid along with their international or tuition fee. But when they apply for post-graduation work permit, the processing time more than 150 days, and the time if their study permit expires, they are unable to renew it, or their health card or health coverage will not be there for that period, and that will be a challenge for many students who are transferring from student status to worker status.
And is there anything that can be done to sort of help with that? Is it a matter of knowing ahead of time that that's what they're doing and kind of getting that documentation in order? Or, is there anything that can help?
It's IRCC's promise is that they are now, the pandemic is over and things are getting back to normal. Processing time is reducing. So if it is within within 90 days or like within that period, it will be easy because most of the students will get their study permit extra 90 days so that they can stay back in the country to apply for their future permits, or if they want to do their post-graduation work or things like that. But if that process is beyond that one, then it will be an issue. But slowly the processing time is reducing, and it may help students to get their documents on time.
Yeah, I would like to speak a little bit. I think accessing the healthcare, like navigating the different healthcare system compared to wherever their home is, it's a little bit challenging, especially when they don't know where to find the first point of access is. What do I need to do when I first come to Canada? Some families still don't know that, we can go to Healthcare Connect for finding family doctors. So stuff like that, and that's why YMCA Immigrant Services are there to help families and guide them, like when you first come to Canada, these are the steps and things that you need to do. But there are also other resources online that you can go to. For example, there's settlement.org that really gives you kind of like the step-by-step things that you need to do when you first come to Canada in terms of getting healthcare and getting into the school systems. But we also have workers that can provide those information. Like, for example, in terms of school, we have like a settlement workers in schools. So I just wanted to share that information with the audience.
Absolutely. You mentioned sort of the difference in the healthcare systems and knowing where to access it was one of the big barriers. Research has also shown that cultural and linguistic differences can be a big struggle. And so are there programs or activities or ways of connecting with the wider community that can help newcomers stay connected to their home countries and their home identity while also learning more of the language and the culture of their new home?
I think that when people come to Sudbury, it's funny how they are able to find their own communities. Like I know the Latina community is very big. They have their own chat and they ask questions, and that's great. That's one of their biggest support and resource, right, is to find their own communities. But we want to support that and promote that community connections at YMCA. So we have English conversation circles. We have French conversation circles where they can practice their English and be kind of more comfortable in that. In terms of communicating for every day and for appointments, just getting used to that appointment basis system in Canada. It's sometimes different for other countries. And we also have welcoming community activities where they can explore the community, the culture here. It's a chance for them to connect and explore.
One of the other things that research often shows can be a barrier for newcomers accessing proper care is health literacy. So the Center for Disease Control and Prevention defines personal health literacy as the degree to which an individual has the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And so when we look at that definition, the newcomers can be well educated and fully able to navigate the healthcare system in their home community, but it can become difficult to know where to look for that accurate health or even other kinds of information. So do you have any tips in terms of where you can find good information around healthcare topics or even other topics, and also how to spot information that maybe you should be cautious of because it may look like accurate information, but maybe it's not?
I think the community agencies are really good, like YMCA, Immigrant Services. I worked there before, so I know the services they provide, and it's also funded from both the federal and provincial government. So those are like key informations. Then, as Wenda mentioned, settlement.org, that's a newcomers service platform, and you can get most of the information and up-to-date information. Again, that is funded from both federal and provincial government. So those are the key. Then Ontario website to get more information. If you're looking for the information that to be translated, or if you need some specific language translation or things like that, you have ATIO, Association of Translators and Interpreters of Ontario. If you need those documents, like without a notary attested document, if they are the certified translators, interpreters, so if you need to use those services, those are also available. I think like YMCA, there is Sudbury Multicultural and Folk Arts Association, and also College Boreal has the same service for immigrants in French. So those are the other services that you can look in the community.
And also the Public Health Sudbury District website is really useful to find information.
I have a couple more questions here, but I want to give the audience a chance if you have any questions that have come up as we've been discussing, or not related to what we've talked about, but health in general. Any more questions that you'd like to ask our panelists at the moment? We're feeling okay? Oh, yeah. Yeah, for sure. We'll get you the mic so we can hear you. You can throw it. That's built for throwing, so if you want to throw it, you can throw it.
Thank you. So this is a kind of suggestion which I want to place to everyone here. As a newcomer to Sudbury, right? So once we enter Sudbury, we come to know through a lot of connects here. We have YMCA and we have other services. But my suggestion is at the immigration itself, if they can help us with these information, because as soon as you land Sudbury, we were not knowing that we need to have a SIN number, you need to apply for a health card, and it is all new for us. So if this can be done at the immigration itself, if they can give us a leaf card saying that you need to apply for SIN and you need to reach to YMCA to get some more information about your health card and some kind of tips at the immigration itself, it will be easy for us to navigate into Sudbury. So that's one of my suggestions which I wanted to give. Thank you.
Yeah, that's a really great suggestion. Yeah, did you want to make a comment on that?
Yeah. So pre-COVID, there was these informations were available at the, like when you land in Toronto or in any international airport, they will have those informations, and that easy to navigate to the services available, especially the federal funded programs, especially like YMCA Immigrant Services. So those informations will be provided from there itself. And if you're coming on weekdays from the office hours, like from 8:30 to 4:30, there is social interest number right in in the airport itself, and you can get your social insurance number. So these informations or those things are little changed due to COVID because of even though the COVID is over, like the flight delays or the processing at the border is still delayed, and if you're not coming at the office time, they may not have the same services at the airport. So these things was there. When I came in 2013, we got a big package from immigration at the border itself. Then we used that one for all these informations. But what IRCC is trying to do for all the new immigrants, there is an info session, and probably you will receive that well in advance, even before you prepare your travel, so that you can do that course and you can complete those information. And that will be a key point or information that you come to know about Canada and the community where you live. So those are there, but not for everyone. There are like certain specific areas for permanent residents or for the people who are eligible for certain documents. Those information are still providing online, but not in general, except that one. It's good that if we have those informations available in border the same way as before, that help many newcomers who's landing or new into Canada and look for those services. Yes.
I think the government is doing a great job of getting information out and the affiliate services and stuff like that. But I understand what you're saying, sir. There's like a disconnect. Unless you hear word of mouth from another immigrant, which is what I always try to do when I know someone from my community is coming, you don't know where to go and get the information. It's everywhere, but you don't know to access that information. You just don't know. I'm a reasonably intelligent person, and when I tell you I know nothing, I know nothing, and I cannot find it on the internet either because I don't know what to look for. There's a disconnect. I don't know how it's going to be solved. I don't even know if it needs to. Maybe us as immigrants who know need to pass on by word of mouth. But I understand what he's saying. And you are absolutely correct as well, because now that I look out for the information, then I see it everywhere. But if I don't know, then I don't see it and I don't know. There's a disconnect.
Right, and that's why I said, like, I think our community is the biggest resource and support for ourselves. Yeah, so it's really great to have that support.
Sometimes hard to find community.
Yes, absolutely.
I understand what you're saying, sir. Find some friends.
Especially in Sudbury, like Northern Ontario.
Yeah, that actually sort of brings me right to one of the questions that I had sort of on my list of things to maybe chat about is Sudbury, being Northern Ontario, is different than Toronto or many other places. So what kinds of, I mean, we've talked about some of those barriers, but does it also have benefits? Are there drawbacks, benefits to Northern Ontario versus another place, and how that impacts newcomers?
I can speak to some of the benefits. I've always lived here, so I don't know really any different, but I mean, our climate is certainly different. We encourage people to get outside and get active, summer and winter, even though it's a little more difficult. For sure, barriers would be things like public transit, and even just when we talk about things like family doctors, the volume is just so much less. So if you were in Toronto or Southern Ontario, even for public health, like there's offices all over the place, whereas here in Sudbury, we have one office. We have one hospital where you have to go to access care. So certainly I think transportation is an issue, and just finding out where the one location is, because there's not stuff around the corner everywhere you go. But you can go skating.
You can go skating just about around any corner you want. Yeah, and in the driveway. True. Yeah, and sometimes without skates. Kind of related to that, I mean, our winters are pretty Brutal, yeah. Brutal is a word many would use. Very different from what many of the newcomers have ever experienced before. So do you have tips around how to stay mentally and physically active or healthy during those winters? They're big ones.
Yes. So YMCA, we host welcoming community activities, and that is to promote their mental and physical health. So we encourage our clients to go out and be active, especially during the winter time. And so we host like activities like skating events, and that also gets them used to this is a cultural thing in Canada, right? Everyone goes out and walk or hike in the winter time, and so just like learning about those things.
And if you go to the city website, there will be a lot of activities happening. Only thing is, you have to look for, most of them are like free events that's happening throughout the year. And like these events, like the city or Science North or community activities from YMCA or other immigrant services, they also provide. And if you are at college, like we have a lot of events happening to welcome all the new international students. So the thing is, look for those informations and participate in those. You get connections. Once you build connection, you have more friends. Then they may know more activities, or like you can get the same support. What I came here, I was looking for all the services. There was someone to support me. When people come to me after that one, I was sharing all this information, how I got those supports and everything. So it'll be like sharing. The way she mentioned, like it's peer-to-peer and or like word of mouth is a lot of supports and things are happening. So that'll be one. One more, sorry. Because of the community is growing, like when I came here in 2013, there was not much, especially from our community, there was not much like the way now the Latin American community is growing. Every community is growing in Canada, and some of the communities are like growing and they're making their own groups. So those groups are really help to other newcomers or another people who are coming from the same community. They're helping. Now, in my community, like last year, we started a formal organization. So that's now in Sudbury. Like we were trying that for like last 10 years, but now we have enough members to go in that one. And we already had like 4 events that one. And some of the events are like 300 people attended. And one of the traditional events that from our small province we celebrated last year, that's for the first time in Sudbury.
Yeah, so finding opportunities to connect with home culture as well as the new culture and take advantage of the outdoors. That's great. I also wanted to talk a little bit about culture shock. So the temperature shock is part of that. But I mean, moving from your home culture to a new entire community, you can, feelings of uncertainty or confusion or anxiety and the stress of it all is absolutely normal and is part of that experience. And so what kind of impact does that have on mental or physical health, and what kind of ways can newcomers deal with that as well?
Definitely, culture shock is, I think, inevitable for most newcomers. It varies between newcomers. It depends on how they come to Canada, whether they're fleeing from persecution, war, or they come here as international students. They come here as a spousal work permit, like their spouses are international students or their family members of international students. It depends. So I think they all face culture shock. It can be a good thing, it can be a bad thing. My client actually mentioned, she said that I faced a good culture shock because I was so shocked how friendly and nice Canadians are. But there are some negative ones that she said. The food here is very different from the foods that they find there back home, and so their diet changes. They find the food here are more sugary, they're less fresh. If they find foods that are healthy or fresh, it's sometimes not affordable, more expensive. So I know that some people, they go down south or order foods from their home country to be delivered here or to bring it back here. So yeah.
I think one thing for mental health, and this is not my area of expertise, is just like we've been talking about, surround yourself with like-minded people, surround yourself with familiar people who are maybe going through the same things as you, find a friend, or even make new friends and reach out to healthcare professionals or service providers. Just don't isolate yourself. Don't let yourself, I'm sure there are times when you feel alone. Try not to feel alone. Certainly, Sudbury is a very welcoming community, and most people are here to help. And so I think it's just really important, especially in the winter when it's dark all the time. You just really don't want to get isolated. So please join the activities and participate in things like even tonight, and just reach out for help. Because if you're feeling this way, chances are your neighbor is also feeling this way, and you're certainly not alone.
That's correct. The main thing is reach out for help. That's something that many are missing, and one of the other many go through the same situation. So it's not, you're not alone. There are even one point or the other, everyone goes through the same situation. So please make sure that you're not alone in the situation. There are always help in the community. Only thing is you have to reach out to those resources, that plenty of the resources available in the community.
Now what I want to do is, we're just about at the end of our time together, but I do want to give you another opportunity as the audience to share any comments or questions that you might have around anything related to healthcare, or other questions that you think our panel might be able to answer for you as well, if you have any questions that you'd like to bring to our attention. Or comments, it doesn't have to be a question.
I want to know about COVID vaccination, because, in different countries there are many shots that we will have to require to fill, right? But now here, I don't know how's the minimum of the maximum shots that you have to do, and where can if I want another extra doses, where can I find it? Because I didn't know it.
Sure. So in Ontario, you can have as many doses as you want. We've had people, up to now, I've given people 7 doses. The minimum is 3 months. So as long as it's been at least 3 months since your previous dose, you can have another dose. You don't need another dose, but for some people, they want to come every 3 months, and that's okay. I think most places, 2 doses is considered enough. 2 doses is a complete series if you need it for work or for traveling or for school. 2 is enough. We certainly encourage people to get at least 3. That booster is important. And you can find the locations on the public health website. So every Monday, they publish the list of clinics for the whole week, and most of the clinics, it will tell you if it's a drop-in clinic or if you need an appointment. Most of the community clinics are by drop-in. The ones that are at the health unit itself, those ones are by appointment. But if you look every Monday, we'll publish a list of where the clinics are for the whole week, and they're spread out throughout the community, different places each day.
Great. Any other questions for our panel? All right. So I want to thank you for joining us tonight. If you do come up with other questions, please feel free to reach out to us, because we are running another session of this in March. And so if you have questions, I will happily add those to the list so that we can bring those to our panelists for that month. I do also have surveys on the tables where you are. If you could take a moment to fill those out for us, that would be lovely. It would just help us to know what we did well, what we can improve on, and just know know a little bit about the session today. Please also feel free. There's refreshments. You can have some of those as well. And if you do have, questions that you'd like to ask us, we are around for a few more minutes, or a little bit longer, as we sort of wrap up. So please feel free to come and chat with us. And thank you so much for coming.